The Richest Man in Babylon was published in the, I think, around 1926, and it was written by George Clason, and it was just describing how the Babylonians were using or were handling their money in the right way. You know that the cultures are quite, different and aligned in a way that is so favorable for someone to grow. Okay, it was really favorable. That's why Babylon in the years, it was the richest city in the whole world. Let me say, yeah, with the way they were living and what. So he picked out all these things, and when you gauge and see the story of how it came about and what, they were the first people to have a written language, so they had to write all the things that we were doing, all the cultures, what, on tablets or stone tablets that these archaeologists found later, and that was the foundation of writing this book by George Clason. What scares me most is reaching a point where I'm given surprise medical bills but I can't pay them, and instead I have to probably get a loan or something like that to cover up. And you get challenges with debts. Of course, when you get a loan, it has some form of interest, and the longer you take to pay, the more interest it grows, you get. So that really worries me a lot. And basing even on my story, I recently have been having some pain in my ear. I don't know whether if you can see it. There's a diagnosis of preauricular sinus was made, and the ENT specialist was trying to say that probably I need a surgery to remove the sinus, the whole sinus and what. But the expenses that I was supposed to incur and what, it scared me a lot. That I was worried that all my savings will just be run down. Of course, with all these things, even though maybe you're in a public system where healthcare is free and what, still there are some things that you can pay, just in case for a surgery and what. So I was thinking to myself that now if I accept this procedure, and then everything that I've saved almost this year would just go onto this alone, just like that. So I had to tell him to just pause for a moment to get to okay, I'm trying antibiotics and analgesics to see if at all I'll get better. But of course, if there is no prognosis and things are worsening like that, I will have an option, but instead go up with this. And this one really forces me actually to learn more and more about healthcare, finances, and how I can manage. So yeah, so let's get onto the lessons that I try to pick out from this book. So in this book, there are several things that I try to learn and understand, that I can relate to save my medical savings. And the lessons, I'll pick out like 6 lessons from this book, starting with like from the chapters that they follow, which I'll just be getting the chapters and then how it relates or how you can use it to save or to fix your medical savings, just like that. Of course, savings for mainly medical needs is not necessarily like an easy thing. Everyone actually faces different challenges, trying to save for medical expenses and what, because we don't really believe that we can get sick at any time. Everyone just believes that maybe we are good, like we can't have that moment where we really need this help. But I don't know, it's unfortunate that quite often we really land into these circumstances, but we can't like help out. So you have to just spend, and if I told you hadn't prepared for all this, then you spend all your savings, even the assets that you had invested, you sell them off just to clear up the medical bills. Now, like currently, I may end up spending my savings, the whole savings for this year, and that will be dangerous for me. So let's start on the chapters. But guys, before we continue, please, I've been checking my analytics and I've realized that a number of you guys don't really subscribe, and I don't know whether probably you could be forgetting that. Maybe you might think that you would have subscribed and what. Please check out and confirm if I told you have subscribed, and this you can also give a like to this video and share it to someone who might really need it. Thank you for subscribing, and thank you for sharing it. So lesson 1 is start thy path to fasten. It's like we're following up the chapters, and the number 1 chapter is starting to fatten your path. Here they were using Babylonian terms, but here, like, when we transform it or we translate it to the current situation, it's like building or saving more onto your healthcare savings account. Necessarily, okay, health savings accounts are not like that much common. I think they are particularly for maybe people in the US and what. But even as, okay, if you're in a country now like where I'm from and you can't access this, you can just open up a special account in the bank, and then that can to just cater for medical savings, or even distributing, because the banks give options for distributing your money to particular points. You get that this one is for medical care, this one is like that, just portioning up into percentages, so you can necessarily devote some money, off your monthly salary or any earnings that you get, so as you can build up this, and this one will really save you quite often. And I picked out this example just for the good of it. And then the lesson 2 is the controlling of expenditures, because at times, personally went off the things of going to gyms and paying for expensive gyms and what. I just learned how to do it at home. You get, try to make push-ups, try to have evening walks, try to because gym as a student currently, I don't know, but it's so expensive for me. It's like beyond my measures, you get. So I try to limit up this and then control my expenditures, this other things, all those things, supplements, about healthcare things, and this, that's some things that I can't really use for even though I need my health so much currently. But many things actually can be used. We have apps, free apps actually, that can can help you monitor and regulate your health, just like that. So as you're aware, or you're sure that you're on the right track for your health, just like that. So there are many free versions or free things that you can actually apply, other than paying expensively for this one. Yeah, so that's lesson 2. Lesson 3 is multiplying your goal. This one, if we to put it back like into healthcare savings and maybe medical expenses and what, so here is like multiplying what you've already saved on your health savings account or medical savings account. So for this one, you can just pick out, let me say, a 3-month savings. If I told you have made a 3-month savings but you haven't gotten any medical emergencies or anything that is related to medicine and what, you can pick out, it's quite risky also. You can try to pick out, because you can remove this money and then all of a sudden after removing the money, then the condition comes in. So you can try to move either 1 month or the 2-month savings, and then you invest it in a less risky venture, probably maybe bonds, stocks and what, that can easily be liquidated. You get, can be easily transferred to cash, so that if at all there is an emergency or what, you can literally pay back. But for a meantime, that it's bringing or is giving you some more money, making more money for you. So that's the lesson 3 that I could get. Then the lesson 4 is guarding your treasures, as a multiply. So here I would relate to as if at all maybe you're able, get a health insurance that is reliable. Personally, I'm not yet here. You get, I'm not under health insurance, because in my country health insurance is literally mainly private. Not everyone actually has it. We are there are very few people that are under health insurance. Actually, most of the people under insurance are NGOs or working with NGOs, maybe working with a very good company and everything like that. Maybe government workers also at times, but not always, you get. So I'm not under this, but this one would be a very good thing if at all maybe you have reached this level. You have controlled your expenditures, maybe your income has, your savings have grown, medical savings have grown, and now you're able to multiply what you've saved. So now the last one, you try to protect that by getting healthy insurance that's really reliable, that can back you up just in case of anything to happen probably. And then lesson 5 is making your drilling a profitable investment. And this one here is like, okay, for the book they translated it mainly to maybe building a house and maybe building a home, a family, like that. But for this particular case, your dwelling is your body, and then your body, you can utilize it to to do everything. Of course, when you're well in your body and physically well, mentally well and everything, you can try to consolidate things and then you become a better version of yourself. So here, if you invest in your health, in your body now, you're secure of the future outcomes you get for what you're going to explain. How you're going to live your life maybe 50 years from now and like that. But if at all, let me give an example where maybe you're not taking responsible, or probably you're doing, because okay, this one is really quite hard, but let me give an example that maybe you're an alcoholic and you take beyond the limits measures of alcohol. So you're not minding about your body, and then you're not trying to invest in it. Let me say maybe you're not trying to invest in simple things like the foods that you're eating, how safe the water you're taking currently is and what. So we could see that times these things accumulate over years. You get, like 20 years from now, 30 years from now, you'll be presenting with the symptoms or conditions that might have started from early before, you get. So if you try to invest more into this, minding what you eat, minding what you take, where you travel, and then having prophylaxis measures, being vaccinated, being screened and everything, this will help you get to be sure of your elderly life, you get. So just like me now, because I have a direct history of prostate cancer and what, so prostate cancer screening and all those tests would be a good measure for me. So, and yet, yeah, I'm planning to do that soon. So you could be having your own issue. Maybe you in a family you have someone that is anemic and what, you can also try to do screenings and what, so as maybe you're sure that this one I'm off it, I'm not yet there. Yes. Then lesson 6, I would say improving your ability to earn. Here is like through the skills that you gain and what. But now when we try to apply this one to medical savings and what, or healthcare finance, we could say that this one you can after growing your healthy savings account or medical savings account, and then you try to improve more of the skills, so you expand your territories just from the savings accounts. Maybe the many policies, okay, depending on where you are. But now for countries like the US, of course, you can use your healthy savings account when it's like, is it high, it has high deductibles and what, so by that you can try to grow it. You use it as an investment instead of maybe a liability or something like that. And it's what like top-notch people have tried to use. They try to use this insurance for their own advantage, because everyone really tries to draw about it, that maybe it's quite dangerous, but I would say that it's so important for us all.